Okay, back pain, why can't I stand up? So it's a little bit of a continuation or a bit more of a development from a video I did last year on this topic. So I can add a bit more information in there plus an extra exercise. So if you have seen the earlier video, this will give you some sort of new bits to think about. And obviously if you haven't seen the first video, this will kind of give you everything all in one go. So obviously when we're talking about, sort of back pain, probably one of the most common sort of injury patterns or kind of symptoms or effects is kind of losing the ability to be able to stand up straight, or not being able to stand up straight without a great deal of effort. So on the sort of the moderate end of the scale, it might be that you sit down for a bit, and as you stand up, you feel it's just a bit tough, like there's something kind of pulling you down, and then you can kind of eventually get yourself upright and carry on about your day. If you're at a real sort of acute aggravated stage with your back, you might not even be able to get upright completely. You might be sort of just kind of on your hands and knees, just kind of like, and it kind of like that, or you do something like you step off a curb, or you do something, you jolt it, and you drop straight away to here, and you're kind of stuck for the rest of the day, trying to go to the toilet and do anything else, kind of like this, and unable to sort of get yourself upright. So what we need to do with any sort of back issue, we need to try and get as much clarity as possible, because when you fully understand what's going on, it does two things. One is it kind of removes that enigma around back pain, where you kind of feel like you're out of control with it, and just this presence that just dominates your life. There's nothing you can do about it on bad days. But also, the clearer you are about how you understand what's happening, the clearer you are about what you need to do to kind of get yourself out of trouble. So one of the most common things to look at with sort of back pain is that for a lot of people it's actually like an instability issue. Like there's certain muscles that you should be using to hold, particularly your lower back, stiff and well supported, so that your hips below can move freely and your upper back can move above it freely without disturbing it. Unfortunately, with sort of the way modern life is, we spend a lot of time sat down. Those muscles tend to get sort of weak and a bit unused. So the way I look at it is like, imagine your spine's like a flagpole in the breeze. Obviously your body doesn't want you kind of all unstable and just kind of about to fall over. So if it can't use muscles around here, which it's supposed to use to kind of get that stiffness for whatever reason, it's going to work its way down the chain. It's going to start to grab muscles, particularly around your hips. That's why if people have got back pain, generally they say things like, I've got really tight hamstrings, they're never loose, it doesn't matter how much stretching I do on them, or I've got really stiff hips in the front. It's because the body's kind of worked its way down the chain. It's trying to get some guy ropes to stabilize that flagpole in your spine, and it just happens to be using muscles that aren't really designed to do that job. They're actually sort of your prime mover muscles. So it creates a couple of problems. One is you're going to have a muscle doing two things at once, trying to hold you upright and move you, but also these muscles, because they're so big and they're so strong, when the nervous system's got them on all the time, they're going to kind of twist you into weird shapes and kind of buckle you forward, especially if the muscles in the front here are grabbing, they're going to buckle you forward, and that's why you literally can't stand yourself up right, because they keep pulling you forward. And that's ironically what actually makes your back worse, because a lot of the pain that you're going to feel isn't to do with a disc issue. If you have got a disc issue, it's actually the muscles that you can feel trying to compensate for the issue being overworked and just being really grouchy. It's kind of similar if I said to you, hold your right arm up all day, your shoulder's going to get sore and tight within a few minutes. So imagine that's going on with your back and your hips, but it goes on all day, every day. You can see why it's going to start to get grouchy and be stiff and be painful and be horrible to live with. So what I'm going to do is I'm going to show you two things. So general idea is that when you've got kind of tightness in the muscles that are affecting the back, what we need to do is we need a way to safely and effectively start to release them a little bit. But also, obviously, if you think back to the guy wire idea, that if your body's put into guy wires and you're going to take them by releasing or mobilizing a muscle, we need to put something else back in there, so you're not just like this, because otherwise the body will just default and it'll just grab back into this again, which is part of the reason why, if you have got sort of tight hamstrings and hips, if you just stretch them just to get rid of the stiffness, it just keeps coming back again. Because the nervous system is just locking that stiffness and that tightness in there. What we need to do is take away the reason why the body's trying to do that. It's trying to create that stiffness with using slightly the wrong muscles. So that usually means you've got to kind of, sort of reawaken to a degree, or get the right muscles to do the job. If you do that and you release the tight muscles, then that's how you're going to maintain that change and get that benefit and start to get it to last a bit longer, so you start to get long-term improvement. So what I'll do is I'll show you how to release the tight spots in the muscle, so you should be able to get yourself upright reasonably easy. But then also we're going to look at more of a long-term exercise, which is going to help stop that from trying to happen in the first place. I'm going to be a little bit out of shot for now, because what I want to make sure, obviously when you've got severe back pain, actually getting down to the floor to do the things that are going to help you is probably going to be your biggest challenge. So I'm going to show you a quick and easy way to get down to the floor without aggravating the back, and then I'll show you the first exercise that we want to look at. So what we want to do is, if you use your hands on top of your hips, put yourself a bit of a brace for your hands to kind of hold yourself upright. Then you want to get into a lunge pattern and just carefully lower yourself down like that onto one leg, then onto the other like that, and that kind of gets you halfway straight off the bat. The biggest thing is when you're trying to get down to the floor and back up again, is you don't want to bend your lower back. As soon as you do that, that's going to just arc everything up again. So if we can use your legs carefully and use your hands and arms as a bit of a brace, that's going to take a lot of strain off your back and help you get down without aggravating anything. Okay, once we're here, we just very carefully come down, sort of fingertips, then come out onto all fours. So what we're going to do is we're going to try and release some of the tension in these quad muscles in the front of your hips, top of your thighs, so you've got that ability to stand up without feeling like something's trying to pull you forward all the time and kind of aggravate the back. So we're going to use a foam roller. What we do is we roll it in towards our leg. We very carefully come down. We drop down to forearms, onto our forearms, legs on the roller. It's somewhere in the middle of your thigh. My other leg, I've just got out to my side, so I feel comfortable and I feel supported, and I don't feel like the back's going to sag too much, or it's going to round, or it's going to twist. I feel like I'm nice and braced. From there, what we do very carefully with your weight, just scour the front of that leg. So come up towards the bottom of the hip, come down towards the top of the knee. And what you're looking for is I mean, it might be a few spots in there it's a little bit tight. You're basically looking for the worst one that you can find. Once you think you've got it, we're going to try and do what we call like a heel pull through. So from there, we just try and pull your heel up towards your bum. Now, if it's super, super tight and painful, just stay on it for now if you can't move it. Even that might be enough. Or you might be able to do like a little bit of movement, and as it starts to let go, you can kind of start to increase the range of movement like that. So you want about 2 minutes per leg. And you should feel that by doing this, it kind of lets go just a little bit. And the more you can get it to let go, the easier it's going to be to be able to stand up straight and get sort of walking normally again. Now when you get it to the other side, so we come from here, back onto all fours, we just slide over to the other side very carefully. Same idea again, carefully lower yourself down, forearms. And you can see on this side now the leg I'm not working comes out to the side. Same idea, you scour. Look for your tight spots, and then we get to work on them. Again, 2 minutes on this side as well. Like that. Once you feel like you've got a bit of relief from it, very carefully come back to all fours, and now what we do is just reverse how we got down to the floor. So we come back to fingertips, grab the top of our legs for a bit of support. We're going to make a lunge pattern, and then we can stand up without ever having aggravated the back anyway through that process. Okay, so we've rolled the leg, we've got the roller out the way. So what we did with the roller is we removed the tight spots. So we removed the wrong sort of guy wire that you're always trying to use to hold up your sort of the flagpole of your spine, if you like. But obviously now we've removed that, there's kind of not much kind of give us any stability. So what we need to do to get that improvement to last is we need to replace it with a different guy wire. So your body isn't tempted to keep trying to use this all the time. So one of the most important muscle groups we need to look at is basically those that are involved in what we call lateral stability. So lateral stability is your body's ability to control you from that kind of, or protect you from that uncontrolled sideways bend. So you sort of your thoracic, your upper back's okay with it, but your lumbar If you want a quick and easy way to really aggravate your back is have it all kind of either sit in a weird position like this, or you're doing movements where you're kind of doing this a lot and that lumbar's kind of, sort of snaking side to side. It really doesn't like it, and it's going to cause damage pretty quickly, which is part of the reason why your body freaks out a little bit if it hasn't got that protection. It tries to grab those muscles in the hips. So what we're going to do is we've removed the tight spot. Let's replace it with the right muscle group. So there's two sort of main muscle groups we really want to look at. One is your obliques on your side, and the other is what we call your QL around the back. What we're going to do is an exercise called Mcgill side bridge, which comes from Professor Stuart Mcgill, and it's a level 1 version, which is generally the best place for most people to start. Obviously for some people it can still be too hard, but it's generally for most people it's a pretty safe place to start. And what that will do is it will help us start to switch on these muscles on the side, these obliques, so that it will start to lock in that stiffness. The stronger they get, the less likely your body to try and grab for your hips and your hamstrings and trying to kind of make up for that deficit. So we get the roller out of the way once you've rolled your legs. You're going to be on your, on your knees on the floor, and then same idea, come down to all fours. But now what we need to do, again very carefully, is try and get yourself down onto your side as safely as you can. Now, there's a little bit, for each person it needs to be a little bit different. I would say just practice, and obviously you don't know if you've done it wrong because the back will twinge. Once you come down to your side, I'm going to very carefully see if you can prop yourself up with your elbow, and you have your knees bent like this. And roughly that sort of elbow needs to be somewhere below that shoulder, maybe a little bit in front. Now, if you look at it at the moment, I've got this kind of horrible sideways kind of banana bend type thing going on, which obviously that's lateral flexion that we're trying to get rid of. So before we do the exercise, we've just got to lift your ribs here, and that puts you straight. So I've gone from bent to straight. When we do this exercise, we don't ever want to go and just collapse and slip back into that again, because that will aggravate the back. So the whole point of this exercise is to build the muscular endurance to resist that temptation, let everything sag. Once we're into this position, all you're going to do from here, with your weight on your elbow and on your knee, is just, if you push your hips forward, they should naturally rise off the floor. So what you do is you come up, like that. You're just going to hold for 10 seconds, like that. If you're lucky, straight away you're going to feel the right muscle kicking in. If you're not, it might feel a little bit vague. Once you do 10 seconds, you just gently push your bum back towards the floor, so it kind of kisses the floor. You just take some of the weight off. But you're not going to just sag, you're going to keep this bit straight. Come up, back in again, and do another sort of 10-second blast. So what you're looking to do on both sides is we're going to do 3 sets of 8 reasonably comfortably. Obviously when you first start, you're going to struggle to do 1 or 2, but just do what you can. And my advice would be do it in small regular bursts. So do like a couple of sets, leave it alone for a couple of hours, come back, do another couple of sets, leave it alone for a couple of hours, come back and do another couple of sets, and try and do sort of like 3 or 4 blasts of 1 or 2 sets each day. As you get better at it, try and do more and more reps. If you say you start off at 1 or 2, try maybe the next day, see if you can get like 2, 3, day after that 3, 4, 5, 6. Try and gradually build yourself up to 3 sets of 8 comfortably. Once you're at the sort of point where you can do 3 sets of 8 well, you're going to feel those hips are going to be a lot looser, and you're going to feel a lot more confident with your lower back. But again, when you're doing them, just make sure you don't get sloppy, don't let anything drop, just from here. Come up and in, you hold for 10 seconds, nice straight line, and then gently come back in between each rep without collapsing, and then come back in. And all you need to do then is, once you've done one side, just very carefully roll into the other and do exactly the same thing. In between sets, I'd have about 30 seconds to a minute's rest. So just enough to recover, but not too long or not too short you haven't recovered. Once you've finished, again, you come back onto all fours, fingertip your way back, grab hold of your legs, and then you can do your lunge pad and then stand up again and get walking again. So for 90% of the people with back pain out there, this is going to have a positive effect for you. Obviously, it doesn't work for everybody because there's sort of subtle nuances between a lot of back pain issues which determine which exercises you need to use. But for a lot of people, that lateral stability is probably your biggest issue. So if you can remove what's creating the immediate problem with the making things annoying your back, i.e. the tightness in the muscles here, so you can stand upright, then once you've got rid of that kind of fake guy wire and you've replaced it with what should be there with the lateral stability with the side bridges, that's starting to get you onto the path in terms of long-term back pain management and being successful with it. And the thing is with that is that you need to then, if you build that ability of that lateral stability, you've got to make sure you maintain it, because if it starts to degrade, that's when you're going to slip back into back pain again, and it's all going to start to flare up and feel horrible. But that gives you, a bit of a starting point with it. There's other exercises you need to do. Obviously, if you're familiar with Professor Stuart Mcgill's work, he's got what he's called his big 3 exercises. The side bridges is just one part of that. But if you want my opinion, for most people, it's probably the most important thing and the most common thing I see an issue with. Also, when people have sort of flare-ups with their back, their ability to do side bridges is the first thing that seems to shut down. So I tend to think it's the first thing you need to kind of try and get back in control of, obviously carefully. And the sooner it kind of switches back on again, you kind of get more confidence with it, and that stability comes back, the easier everything else becomes. Okay, so a bit of a summary. So that's, that lateral stability, again, is probably the most common issue I see with a lot of people. And if you fix that, it's kind of the first major piece in the puzzle to be able to build a pain-free back that's going to last. So with back pain, you can always improve a situation, if not fix it completely, provided you accept the fact you've got to, if you understand the problem, there's certain things you always need to keep on top of. So keeping strong in that lateral stability, maintaining that is what gives you a nice stable foundation for sort of a pain-free, more robust lower back. So it's something, you don't just do it and forget, you've got to do it and maintain it going forward, and that's what lets you do all the things you want to do, like just walk around or train or play sport, whatever it is you may want to do. But again, there are subtle nuances. This sort of stuff doesn't work for everybody, but that'll probably work for like 90% of the people that suffer with long-term back pain. If you can get these bits to relax and then replace that with confidence and stiffness up in here, that's how it's going to start to last and becomes more of a long-term solution for you. So obviously, if you're in Sydney and you're struggling with back pain, get in touch. I'll put a link below the video. You can always come in for a consultation, we'll have a chat and get you on the right path. If not, I've got plenty of videos on YouTube that might give you a starting point. Another thing is I'd definitely look up the work of Professor Stuart Mcgill. He's got some great books out there and DVDs that can help with this sort of stuff. But obviously you've got to be honest with yourself. It's not going to be easy, it's not going to happen overnight. It takes quite a bit of work, but as long as you're methodical with it and you're committed to it, you can indeed build a pain-free, robust and strong lower back.